Let me start with some sobering and worrying statistics about mental health in our WHO Southeast Asia region. Over 260 million people live with a mental health condition. We experience more than 200,000 suicides every year in our region. Alarmingly, for every suicide, there are more than 20 suicide attempts. In several countries, the treatment gap is as high as 75 to 95%. Let that sink in. That's the treatment gap. 95% are not getting any kind of treatment. COVID-19 has triggered a 25% increase in the prevalence of anxiety and depression, and I think all of us can vouch for that. These figures are worrying, but also not necessarily surprising. Historically, stigma and discrimination has characterized the outlook and approach to mental health in the communities of our region. However, while we undeniably still have a lot of work to do, it is heartening that we have made the progress that we have in recent years. In 2022, our member states adopted the Paro Declaration and committed to the universal access to people-centered mental health care. This people-centered mental health care represents a shift from one-size-fits-all solutions, and instead, it advocates for approaches that are holistic, community-based, and personalized. The preferences and unique circumstances of individuals get prioritized, promoting their dignity and autonomy. As you may know, our WHO Southeast Asia Regional Office has developed the Regional Mental Health Action Plan 2013 to 2020. The core components of the plan include leadership and governance, community-based mental health services, promotion and prevention, as well as data and research. Earlier this year, when I assumed the role of Regional Director, I formulated the priority areas of focus for the duration of my tenure. After consultation and endorsement by our member states, we have codified this into our regional roadmap for results and resilience. I am pleased to say that the very first pillar of this regional roadmap calls for reinforcing mental health, well-being, and the quality of life for all. This aims to promote a holistic and comprehensive approach to all public health and healthcare programs, from health promotion to rehabilitation, and across the life course. It ensures that mental health is integral to the overall health, well-being, and quality of life of our population. Therefore, I'm pleased and proud to say that our Southeast Asia region has made a decisive commitment to promoting and treating mental health and well-being for everyone in our communities. People-centered care must include the voices of those with lived experiences. Their insights are invaluable in shaping national policies that are truly responsive to their needs. Also, feedback mechanisms are essential to ensure continuous improvement. When individuals have platform to voice their care experiences, services can evolve to better meet their needs. Finally, building resilience within communities and individuals is fundamental. Resilience helps individuals view setbacks as manageable and temporary, fostering recovery and sustained well-being. Promoting mental health literacy is a vital component of this, empowering communities to support each other and dispel stigma. This also connects with the necessary deinstitutionalization of mental health care. Historically, mental health care has been synonymous with institutionalization. However, as our understanding of mental health has evolved, so too must our methods of care. Despite the enormous progress made in understanding mental health in the public health sector, long-stay institutions still exist in our region and in many other parts of the world. This deinstitutionalization movement recognizes the shortcomings of isolating individuals in such facilities and the need for a more holistic and community-driven approach. Recovering from a mental health condition isn't just the responsibility of the individual. We are people, we are social human beings. We need our community, we need our loved ones around us to help us recover. This PEMA initiative in Bhutan serves as a shining example for our region. Under the guidance of Her Majesty the Gelson, PEMA has pioneered coordinated efforts to streamline mental health services across multiple sectors. And I truly commend the effort. By harmonizing interventions and focusing on resilience and societal support, it provides a model for scaling mental health care in other settings. As I conclude, I'd like to remind us all that mental health is not just a health issue. It is a social issue, an economic issue, and a human rights issue. It intersects with all aspects of life: education, employment, and social inclusion. I'd like to thank Bhutan and the PEMA initiative for the excellent work you've done and continue to do. I commend Bhutan for your leadership in our region in prioritizing mental health and disability within your public health sector. You can always count on WHO to support you. You will always have a partner and a friend in WHO, as well as the Southeast Asia Regional Office. Thank you.